Hi, everybody. I'm so sorry for the wait. The judges have been very busy deliberating. We had some absolutely phenomenal pitches today from teams, just incredibly inspiring. We have the MIT team right now is working to finish up actually even some of the award slides for that, but I'm going to go ahead and get started. So bear with me for a moment while I share my screen. Well, what an amazing weekend. Thank you all for joining us. I'm going to move right ahead to, we are now here for the award ceremony and also to talk about next steps. But first, it's my honor to introduce Peter Bar-Gillespie, the Executive Vice President and Chief Research Officer at OHSU Research and Innovation. He is also a professor with the Oregon Hearing Research Center and an affiliated scientist with the Volum Institute. Dr. Bar-Gillespie maintains an active research program funded by the National Institute of Health in order to explore the molecular mechanisms that enable our sense of hearing. He has been with OHSU since 1999, and we are honored to have him here today to give some opening remarks. Take it away, Peter.
Thank you very much, Sarah. I really appreciate everybody on the call for having joined us for this inaugural OHSU Invent-a-thon, and welcome to the award ceremony. I want to personally thank Sarah for all the hard work that she put into this event, along with the many, many other people who worked with her, including some from my office, OHSU Research and Innovation. We've been happy to help support this event, along with the many, many other people who have supported it. So why did we, OHSU, bring the event together? I think as an institution, we're deeply committed to advancing innovation. As you know, our principal missions at OHSU are research, education, and healthcare. And by creating products of all sorts that can help people, we can satisfy each of those missions. I'm a firm believer that research at OHSU can and should lead to innovation. And in turn, the outcome of that research should be improved lives of people in Oregon and beyond. So I think you all also know that collaboration is integral to innovation. There's a societal picture of a lone inventor long suffering in her lab or his garage, but that's not how it usually works, as you all know. We work together to bring ideas to fruition. And I think events like this are energizing because they bring together creative thinkers from diverse disciplines and allow them to connect together to exchange ideas, consider new possibilities, kickstart new projects. And I think over the weekend, many of you have done that. So we also intend for this event and others like it to be a focal point for fostering collaboration between academia and industry, as well as for synergizing our efforts to advance healthcare innovation. So I'm really glad that so many creative and bright minds came together this weekend in the midst of a global pandemic, no less. As we've been doing for the last 8 or 9 months, we're learning new ways of doing things. And what happened over this weekend is another example of that. So together you brainstorm to build solutions to troubling problems. And I think in the end, we'll improve health for all of us. It's a real testament to your determination and imaginative spirit. So I'm also particularly proud that the organizers are using this event to help tackle urgent needs related to healthcare disparities. I would just say that the shocking differences in health outcomes for the white majority compared to marginalized community members, including those who are Black, Indigenous, or other people of color, demand that we focus our attention on these disparities. It's a societal imperative, in fact, that we work together to offer healthcare outcomes that for all that don't differ in based on your community, your race, or socioeconomic class. And all of you here have an opportunity to contribute to tackling systemic and institutionalized racism in healthcare. And I applaud you for working on projects that do that. So I hope that this event is just the beginning for you, that you consider to be a jumping off point for growing the connections that you made this weekend. So we encourage you and your teams to take advantage of the follow-on support and resources that are available through OHSU and through our partners, and carry your projects forward. So thank you again. I hope you can join us for the post-hack, and all of us look forward to learning about your team's progress then. Thank you, and I'll turn it back to Sarah.
Thank you so much, Peter. And I want to continue and thank you for your support of this event and the support of the individuals in your office on this event as well. I want to move on to the next slide, and I want to continue with this theme of thanking. We will get to the words, I promise, but there are some important people to thank. As Peter mentioned, there was an enormous team that helped put this event together. I want to start by thanking our wonderful judges who joined us today from all over the country to help judge these teams and ask fantastic questions. You can see our surgical care judges here. You can also learn more about them on our website. Here's our early disease detection judges, our rural health judges, as well as our management of chronic conditions track judges. So thank you, judges. We'll do a round of applause. I also want to say that I had the incredible honor of working with the most amazing and fun team to put this event together. So here are all of their faces. We're going to actually go through their names as well. But I want to start off by giving a special thanks to two specific people on this team who just worked tirelessly on putting this together, and they could not ask for two better teammates. So I want to just give a special shout out to Natalie Lovelace and Brittany Hale. Thank you two so much for all of your efforts, especially over the past couple of weeks as we got the final details together for this event. We could not have done it without you, as well as all the other members of this team. Here is our wonderful tech team. Thank you to our Jillian Wagstaff, in particular at OHSU. Oh my goodness, Jillian, thank you for all your efforts, incredible. The team at LastLink, as well as the team at Microsoft. Thank you, Carl and Sam and Vish, Pavan and Taki. We had an incredible implementation and steering committee team that was incredibly dedicated to this event. As many of you know, this event was supposed to happen in person in May initially, and that did not happen for some obvious reasons related to COVID. But everyone stuck with it. It was incredible. This team for this event was so incredibly dedicated. And when we decided to make the pivot to the virtual environment, they all came with us. And we actually had new team members that came on. So we've been working on this for a year. We've made many, many pivots, including even over the course of this weekend. So thank you everyone who was adaptable to tech issues and other things that arose. What an incredible team. So I want to call out, I have a couple slides of individuals. We'll share these slides with everyone so you can learn more about all of these folks. Unfortunately, we don't have time to go through everyone's name, but what an incredible team we've had, including people not just from OHSU, but from many, many partner organizations that were embedded on our implementation team, doing everything from helping to get the word out about the event to actually putting together spreadsheets and all the other fun stuff. So thank you, everyone. I also want to give a special shout out to the MIT Hacking Medicine team. They also remained incredibly committed to this event, even when our event in May had to be canceled, and they stuck with us when we decided to try to do this virtually. So thank you all. Particular thanks to Tanya Takar and Freddie Winn, who I've been working with for quite a while now. Thank you too. And just what a wonderful opportunity to have the opportunity to work with MIT Hacking Medicine on this event. We'll feel so lucky we've had the opportunity to learn from this incredible model that you've developed, and also to have a chance to build off of that. Next, I want to thank all of the participants and mentors who were part of this event. As you know, we had hundreds of people joining us from over 200 cities across the world, and we just had an incredible range of expertise, backgrounds represented at this event. I exaggerate 0% when I say that I was blown away by the pitches that I had a chance to hear today. I am just so impressed by the solutions that the teams came up with this weekend, and that would not have been possible without all of the remarkable expertise and mentorship and guidance that was provided by our mentors. So we could not have done it without you. Thank you so, so much. So now I get to switch slide decks because I'm going to talk about the winners. And Tanya just told me that she finished putting together the slide deck. So we actually had so many phenomenal teams that we decided to give away third place prizes. So I'm going to go ahead and share that. So we now have first and second place prizes for each track, in addition to third place prizes. There were just too many good teams not to do that. Down to the winners. Here's all our teammates. We made it, you guys, the end of the weekend, team. Amazing. Good work, everyone. Oh my goodness. Winners. Okay, so I will start off with the surgical care winners. I'm thrilled, and I had a chance to listen to these myself, and oh my goodness, I was blown away. First place goes to Cathport, second place to DIY Surgery, and third place to Socket Rocket. I'll give you all a chance just to read for a sec what these folks did, but I'll also just mention the solutions here. So Cathport is working on a novel device to make catheters obsolete. DIY Surgery is working on a surgery trainer that allows surgeons to practice their skills before they operate on the first patient. Socket Rocket is working on a smart, adaptable prosthetic socket. And then we also have our Disparities Prize winners. So Cathport was also a winner for the Disparities Prize, and they are working on a problem where all current urinary catheter options are cumbersome, complication prone, and decrease patient autonomy. So they have a novel device to make catheters obsolete, and it is quite incredible. So I look forward to having them back, for all these teams back for the post-hack event, and all the teams that participate in the event are welcome to that, to compete for some additional funds. Next is early disease detection innovation winners. So we have first place, we have democratizing digital pathology. So they are focused on underrepresentation of different ethnicities, and the lack of digitized pathology slides leads to adverse outcomes. So their solution is to outsource the digitization of pathology slides to increase access to and frequency of digitization to improve health outcomes. Althea, which is the Teen Suicide Prevention Group, and I believe this team was led by a high school student, I will note, was second prize. So teenagers around the world, especially in diverse and underserved areas, often struggle with depression, leading to suicidal thoughts and actions, and kids may not be aware of the existing resources or may not reach out due to stigma, parents, or fear of exposure. So the solution that they came up with was a product where kids who are struggling with their emotions can seek help immediately. They can talk to preset and customizable emergency contacts, get mood-based suggestions from an AI-powered chatbot, participate in calming activities, connect with therapists and school counselors, or learn about stress, anxiety, or depression. How great is that? Our third place is CanCern. So the problem they're focused on is cancer patients have a tedious, non-personalized screening protocol during their remission, even after suffering a difficult joint journey. The solution, we provide a bespoke subscription CRISPR screening kit for home diagnostics in coordination with the patient's care team for accurate and personalized relapse detection. So I want to just pause for a moment to say that we had 4 tracks, 4 meetings running simultaneously for these tracks. If you missed hearing about some of these great teams, it's not too late. We have recorded all of these, and we'll be sharing those recordings with everyone who is registered for this event, all 720 of you, and you are able to access and watch those at a later time. Because I want to see the pitches for these. I haven't seen them either. Disparities Prize. So Memorable is the team that won for the Disparities Prize for early disease detection. So the problem they were looking at was a typical diagnosis of Alzheimer's occurs too late. Earlier diagnosis would help increase quality of life and reduce costs. That is very true. A multifaceted at-home testing approach, which would track cognitive changes over time, allowing for early detection of Alzheimer's. And hopefully we'll also have a cure for that at some point too. Okay, I'm moving on to rural health. So first place prize for $3,000 goes to Remote Medical Support Center. So the problem they were addressing was that the lack of accessibility in rural areas to medical professionals for proper diagnosis leads to mortality from preventable conditions. Their solution was take the doctors to the patients through a kiosk machine, which can allow people in remote locations to effectively communicate with a doctor. Second place is Pipolo. I hope I'm not butchering that name. And their problem was 1 in 3 American adults is at risk for CKD, with higher rates of undocumented cases in women minorities in rural areas, which have fewer resources to prevent and treat chronic diseases than urban communities. But even more concerning is that 90% aren't aware they have it, and early detection is critical when the disease can be slowed or stopped. So their solution, they have a secure app that uses common items like a Ziploc bag, tinfoil, and a smartphone, driving affordable and accessible, as 75% of the rural populations has a smartphone, an existing third-party integration to screen patients for macro, urinalysis, hemoglobins, vitals, and even a mental health to be routed to the doctor for clinical CKD testing. Wonderful. DiaCare, the problem they were focused on was how do we ensure early disease diagnosis and prevention of foot complications arising from diabetic peripheral neuropathy, such as gangrene and foot infection that poorly affects the mobility and quality of life in high-risk patients suffering from diabetes in rural and low-resource settings of India. The solution was DiaCare. DiaCare is a complete foot assessment and rural care management tool for rural India. The disparities prize goes to Communutri. So the problem there was that low income and rural communities suffer from the highest levels of diabetes and the lowest access to healthy foods. As a result, sustainable, tailored nutritional planning and knowledge sharing between patients and providers is rarely achieved. The solution, an application that provides diagnosis, focused meal plans to patients with food, meal delivery options, directions to pick up fresh ingredients from local farms with a social media platform and online nutritionist consultant. So last track, we have management of chronic conditions. First place goes to Turtle AIP. So aging in place is difficult and not efficient. We built turbo devices and services to connect family, caregivers, and seniors. Wonderful. Asynchronous senior care. Older adults with chronic conditions are at high risk for adverse outcomes that could be prevented by non-urgent asynchronous communication with their care teams. Ask is a voice interface for the patient portal of an electronic health record, which empowers older adults to take charge of their own healthcare. Third place, we have Team Shock and Awe. Detection of symptoms in anaphylaxis can be difficult, but delayed injection of epinephrine can result in hospitalization and death. Solution, an all-in-one device built into your phone case to detect anaphylaxis immediately, inject epinephrine, and alert others to help. Okay, last prize here of these tracks, and then we have one additional prize I'm going to mention. So the Disparities Prize, Freedom Link, so a lack of continuity of care for mental health services and medication for people leaving jails. The solution, linking people to mental health services between jail release and enrollment in community health centers to support management of chronic mental health disorders. Okay, wow, what an incredible set of teams. So our partner Onami has also offered a prize to direct digital pathology. This is an in-kind prize in order to help guide its promising innovation to market. The market and customer discovery work will be a collaborative effort among the team, Onami market specialist Len Blackstone, Onami entrepreneur in residence Dr. Kyle Gee, and Onami president and executive director Skip Rung. So it sounds like you're going to get a lot of help from these wonderful individuals, have an enormous amount of expertise in terms of being able to do customer discovery and market research for your idea. Congratulations. So we also have some additional prizes that will be awarded to the teams. So our partner Jomi has offered a one-year subscription to all of the winners of each track. AMWA, all winning teams will receive membership to the American Medical Women's Association. Thank you, Eliza Chin, for that. That's fantastic. Our partner, Lisa at Oregon Bioscience Association, has offered Invent-a-thon winners that will receive team membership in Oregon Bio for a year and complimentary registration to Oregon Bio Digital 2020. This is a fantastic conference, the Oregon Bio Digital 2020. I encourage all of you to look it up online or click on the slides that we have or go to our resource page on our website. This is going to be an incredible conference. It's happening next month. I encourage all of you to go check it out. And that conference is focused on amplifying diversity of discovery, access, and economics. So I really encourage you to join on November 17th through 19th. And we already talked about the NAMI Prize. So I want to say again how much we appreciate our sponsors making this event possible. So we've gone through our sponsors before. I want to just call out our platinum sponsors one more time, which are Hillrom. Thank you so much to Eric Agdepa and his team. Cambia Grove, thank you to Maura Little and Jessica Hafleur. Thank you so much to OHSU Department of Surgery, the OHSU CEDAR, as well as to ITG. Thank you again, Bridget Barnes and team. I also want to thank our gold sponsors, OBI, Adventurine, Intel, Stoll Reeves, Oaktree, the Department of Emergency Medicine, and OHSU Research Innovation. Thank you, Peter and team, for all of your support. The OBI, if you are looking for a place to launch your startup here in Oregon, this is a great home for you. I also want to thank our silver sponsors, the Portland Seed Fund, Cardinal Kit, Link Oregon, Hyatt House, ST Innovations, Onami, Oregon Bio, Last Link, who helped put us make this event virtual, OHSU Tech Transfer, OHSU Department of Medical Informatics and Clinical Epidemiology, as well as OHSU Collaborations and Entrepreneurship. We had team members from many of these groups that were integral to making this event possible, and we are incredibly appreciative of their support and assistance. We also have a lot of in-kind, various folks who helped with promoting this event and providing various types of in-kind prizes. So we thank all those partners as well, many of whom you had a chance to hear from in the lightning pitches. So I want to just leave with a few last thoughts here. And the main one is we really hope you'll keep collaborating. So what an amazing diversity of folks. It's hard to kind of step outside of our usual silos to collaborate with people with different expertise than us. I hope you've made some of those connections here this weekend and that you'll keep working together. You can stay connected with the folks in this event by following us at OHSU Invent-a-thon, either Twitter or LinkedIn. You can also go to the participant hangout to see all the individuals from this event and see their LinkedIn profiles. They're all there for you. Of course, continuing to collaborate across, when you have team members across the world, can be challenging. Happy to let you know that thanks to our partnership with Microsoft, we will be able to keep this virtual space open until our post-hack in April. Thank you, Carl, Sweetland, and team for all your incredible dedication to this event and making it possible virtually. And hopefully everyone got a good appreciation for MS Teams this weekend. It has many, many wonderful features. And thank you, of course, so much to the ITG team for making that all possible and making it go, especially Jillian Wagstaff. So the virtual space will stay open. You can keep collaborating with your teams here. It's all open for you. And I also want to mention, keep going with your projects, keep collaborating and keep going. So a few other, you can take advantage of resources that are available through our resource section of our website and also through our MS Teams site. So you can also continue to connect with our partners here. So we have had fortunate to have many partners for this event, many of whom want to help teams keep going and moving their projects forward. So please don't be shy. Go ahead and reach out with them. We have these two vendor breakout spaces here in our MS Teams site. You can go there, connect with people. A lot of them are standing by right now. And it's a great place to go connect with folks and learn more about these incredible resources like Cambia Grove. So thank you again to all our partners. They're here to help us keep moving these projects forward. And we feel so incredibly lucky to have had the opportunity to work together with you on this initiative. Once again, you can go to our website to find resources as well if you go to our resource tab at invent-a-thon.org. And lastly, as you are working to kind of move these solutions forward to make healthcare better. Just remember some of the inspiring words that you heard from our keynote speakers about their own journeys on the healthcare innovation path. They're not always straight, as many of them alluded to. So don't get discouraged. Keep working together. Keep taking advantage of the resources. All of our partners here are here to support you in doing that. And many successful startup companies have been launched out of weekends just like this. This is just a spattering of a few of them. So I hope that provides some inspiration for you. And no one came out of this event, none of these folks came out of this event with a solution ready to go. They all had to keep working really hard on it and take advantage of support and resources that were available to them. So I hope you will all do the same and take advantage of those resources. We are going to have a post-hack event on April 21. Hopefully that's easy for everyone to remember. And we are really excited to use that as an opportunity to invite teams back. Anyone who is a participant in this event can actually go right now to bit.ly/Invent-a-thon Post-hack to register for that for free. And we will look forward to inviting you back to give away more money. This time we'll be having larger prizes, around $10,000 to $15,000 for teams. And this is going to be a 3-hour event, not a 3-day event. And we really look forward to seeing what progress you make between now and then. And we'll be staying in touch with you all along the way. So please let us know how we did. A lot of people we've done a lot of building the plane while flying it for this event, including having to do some pivots over the weekend itself. I can assure you that we all worked as hard as we possibly could to make this possible. But we want to keep iterating on this, just like we do with our innovations, and trying to do this better and better every time. So please give us your feedback. My colleague, Natalie, I believe, is going to be posting a link to surveys. We also will be following up with you for surveys as well. And then I want to invite Jennifer Chi. Are you here right now to talk about one of the things you'd like teams to do next if they're interested? I don't know if Jillian's able to, if Jennifer's able to unmute.
Can you hear me?
Yeah, go for it.
I'm just clicking the buttons and hoping that you can see me and you can hear me.
We can.
Good. Hi, everyone. Jennifer Chi. So we created a Giphy video photo booth for you. We've had a few teams create that. And that's like our gift to you, our gift to you. And we want you to use that to let everyone in the world know about the great time you had this weekend, what you worked on, certainly to tag your teammates and stay connected. And so we're going to send out a spreadsheet for signing up, maybe starting at 5 o'clock will be the first time to be able to go in and for 5 minutes go in and get a little video recording. And then we'll send out a gift to you in the next day or so. Alternatively, you can go into your own Zoom room, make a recording, and then just load it in that same area. Just load the file. If you choose to go that path, just please do that by midnight so that we can get those over to our team to make those for you. And thanks so much. And don't forget to tag hashtag OHSU Invent-a-thon.
Thanks so much, Jennifer. And we will be following up with each of you to find out more about how we can help you moving forward. I do want to say that one of the things we're hoping to do from this event is just learn how to do events like this better. So your feedback is absolutely essential to enabling us to do that. So I just want to give, I don't know, we can all unmute for a sec, a round of applause to the Invent-a-thon team, all of the people who brought this together. Thank you, everyone. And it's so weird talking to a completely silent screen.
Thank you so much.
So, thank you, everyone. And we'll be in touch soon. Please stay connected.
Thank you.